Welcome to the special live edition of our news program. Did you know that about 40,000 babies are born with congenital heart defects in the US alone every year? Even after they undergo life-saving heart surgery, these babies are still at risk of a lethal heart condition called arrhythmia. However, this new report from Team TCH at Rice University shows remarkable progress in tackling this by predicting for this condition in real time, potentially revolutionizing the way doctors treat arrhythmia. We'll be heading live to Yeren, our reporter live on the scene, to tell you more about this latest news story.
Up until now, doctors or nurses had to look into the heart condition real time to see if patients have arrhythmia. However, Team TCH has developed an algorithm that informs the doctors when the patients will need proper treatment or medication by predicting the patient's heart conditions. Hello team, what were the inputs for your algorithm and how does it work?
Hi, I am Robert Chen, the head researcher of Team TCH. For inputs, we use two datasets, electrocardiograms or ECG and central venous pressure or CVP. As you can see, ECG signals measure the electrical activities of the heart, while CVP signals measure the average blood pressure in one of the large vessels that return the blood back to the right atrium. Cardiologists are able to detect abnormalities and diseases of the heart by looking at how these waveforms change over time. However, oftentimes, doctors would not be able to monitor these signals all the time due to the massive amount of data and a huge number of patients. We built this algorithm to help them detect this specific kind of arrhythmia called junctional ectopic tachycardia, short as JET. Some of the main issues we ran into while developing this algorithm include noisy raw data and the huge variation of biosignals amongst patients.
So, how does the pattern change and how does the algorithm detect the change?
Pictured here is the ECG signal, a measure of the electrical signals of the heart. A healthy heart typically exhibits this peak, known as the P wave, but when jet occurs, this P wave disappears. This large peak is known as the R peak, and its behavior can also be affected by jet. In order to detect these changes, we developed an algorithm which creates a template waveform and then shifts, stretches, and scales the P wave and R peak of each sample to fit that template. The amount of shifting, stretching, and scaling done gives us 6 features, which we then input into a random forest classifier to determine whether jet is occurring.
I see. How about CVP?
Hi, I'm Yan Dai, the CVP researcher. Central venous pressure, or CVP, is another signal we used for jet detection. Upon jet onset in each CVP cycle, the C wave will merge into the A wave to form the dominant peak. CVP has never been used for jet detection before, and we started from scratch and developed a complete pipeline cleaning and stacking the CVP cycles. We extracted features from the cycles, including the statistic features of each cycle, such as the range of the amplitude and the prominence measuring the peak relative height, and also features from the wavelet analysis capturing the major changes in each cycle. And we trained a support vector machine on all extracted features for jet detection.
So, how was the result?
Hi, I am Xin, and I am the result researcher. Our team can deliver 3 research results. The first one is a complete feature analysis pipeline. Both ECG and CVP signal will be transformed into different features, and these features will feed classifiers, which will finally provide a jet detection output. This output is connected to an alarming system, so as soon as a jet happens on a patient, the physicians will be able to know and provide the most timely and treatment. The second result are high accuracy classifiers. We train 10 models through cross-patient training and testing. In each one of them, one patient is left out as a testing set, and the remaining 9 of them are the training set. The resulting median R curves for both models based on ECG and CVP are all above 90%. Finally, we have built 2 tools for physicians to analyze the long-term cycles in just one figure and labels all the cycles in just one click.
The high accuracy in detecting jet and visualizing tools of this real-time monitoring system will help doctors to save their time and cure more patients. We expect to see fewer children die out of arrhythmia in the future.
Thank you so much, Yeren. Looks like great progress is being made. Stay tuned for some upcoming reports as we take a short break.